from Bakersfield, and I am a volunteer with Consumer Watchdog. Probation monitoring. Well, we need information about how the probation monitoring system works. I want to know how many probation monitors you have. I want to know how large their region is and how many doctors they monitor. I want to know who the probation practitioner is to determine if the practitioner has a personal relationship or a professional relationship with a doctor that's on probation. I can say that I live in a smaller town and all the OBGYNs know each other personally or professionally. I want to know what process is when the public reports probation violations. With Arthur Park, we reported when he broke the patient notification portion of his probation, and the probation monitor would not accept the report, stating it was not her job. This was a special condition of the probation. It was not monitored and it was not addressed when reported. We need to be specific guidelines on how probation is monitored. All death complaints must be investigated. You must adapt the Department of Consumer Affairs prioritization guidelines. The medical board is one of the few boards that does not follow these guidelines, and deaths and lifelong harm cases are being dismissed. The CDA complaint prioritization guidelines requires that death cases be referred directly to an investigation. You will prevent repeat offenders, and you will show the public and legislature that doctors' livelihoods are not favored over patients' lives. And I am calling on a maternal mortality study to be conducted. There is a maternal mortality crisis across the state of California, but there is a crisis in my community. We cannot ignore this crisis. It is at a high level. I don't see any specific accountability methods that you are using in enforcing to help stem this crisis and make maternal health care safer in our state. As part of this study, I want to see how many complaints you have received that come from a maternal health death or lifelong harm. I want to see how many of those complaints require discipline,
30
which
seconds remaining.
which discipline actions were taken. I want to see how many complaints were linked to a repeat offender or a suspension or other measures that were taken to protect the pregnant mothers and babies while investigating a new complaint. The study needs to be reviewed in a public setting. We need to look at specific steps that will be taken to enforce, especially with a repeat offender, to curb this crisis. I want statistics broken down by
Please conclude.
ethnicity, not race. I want it broken down between Medi-Cal, providers, and private insurances. Thank you.
Thank you for your public comment.